Welcome, beautiful people. Now, if you watched my previous video, you would know that I intend to do educational short and intend to keep it very basic. Okay, so if you're a like a medical provider and you want like a high level or actual like clinical terms and medical terms and all that, this will not be the main video for you. I'm planning on keeping it very basic at this level. So, again, my specialty is neurology. So, I'll be talking more about brain related diseases. But let's just start with the very basic thing. What is the brain? The brain is a very important organ in the body because you think about it like this: it is the command center, the control system for your body. You talk of controlling sensory information, emotional, memory. Like even before you go pick up something, there are several processes that has to happen, and it is all being interpreted and happening in the brain. You know, the visual input, me looking at something and recognizing that, oh, this is an egg. That is all because there's a part of my brain that is interpreting this to me. So it is the command center, the control system for everything we do. That is why, in certain conditions like stroke, if a part of the brain is damaged, then a person's arm per se may not work because that area of the brain that controls the function of the arm, that motor skills or the sensory ability, is inactive, is not working anymore. For the lack of a better word, is dead, is atrophied. There's a blockage to a blood vessel that feeds that specific section of the brain. So it does not function anymore. So that's just a very simple, basic example. But the brain is a very important role. That's why when, people are laying there in very harsh conditions and like they get sick and they're called brain dead, they're considered basically dead, unfortunately, because that organ that is supposed to control everything they do is not working anymore. So now, again, referencing my previous video, I had said I went to a medical conference. I met a lot of neurologists, neuropsychiatrists, neuropsychologists, and I did my little survey. So I went around asking the presenters, the providers, even the staff, what they thought about the brain. Like I wanted them to give me one simple statement or explanation or word, one word used to describe the brain. I got all powerful, outstanding. Three people said complex. I got one other person said it is intelligent, incredible. I mean, you can just get where I'm going. The brain is indeed a complex organ. So now, knowing how complex the brain is and knowing how what it can do and how incredibly I had the word fragile, and I was actually interested, when the person mentioned fragile, it kind of like, yes, the brain is fragile to an extent, so we have to take care of our brains. Now, again, like I said, because it's so complex, I have to pick one aspect, like one condition, and focus on it. And if you're interested in any specific topics, I can delve into it later on. But right now, since I just came from a dementia conference, we're going to focus on that dementia. So, memory in general. Now, just to say, memory is just an aspect of cognition. And also, a lot of my patients ask dementia. What is dementia? And it is really good to understand that dementia itself is not a disease. You cannot just say, oh, this person has dementia and that's it. What is the etiology? What is causing that dementia? Dementia is a clinical syndrome. So maybe a family member, a friend, you see they're not acting like themselves, they're having trouble coming up with words, they're being forgetful, just there is something off. They're not really understanding you. They're making decisions that are not sound. This is all part of cognition. Then once it starts to affect how they actually live and function, affecting their instrumental activities of daily living, paying bills, taking care of their finances, grocery shopping, when it starts to affect how they actually take care of themselves, activities of daily living, just grooming, showering, dressing, cooking, things like that, then they're diagnosed with dementia. Some people can have some impairment, but it's not affecting how they function, and that will be called mild cognitive impairment. So, now, this video, if you're also like a caregiver to a family member or a professional caregiver, um, and you want to know more, I would encourage like family members, even if you're a patient yourself and you're watching this video, when you go for your neurological exam or evaluation and you're diagnosed with dementia, it does not stop there. You have to ask questions, right? What is causing the dementia? Because dementia, again, by itself is not a diagnosis, is not a disease, it is a clinical syndrome. The most common cause of dementia is Alzheimer's disease. And in Alzheimer's disease, there are certain proteins that either forms plaques or forms tangles. A lot of people know about the amyloid plaques. So there's amyloid plaques and tau tangles. Now, when this happens, it disrupts the function of the brain. I explain it to my patients this way. You got a brain cell here, a brain cell there, and now you got this plaque in the middle is interfering with information, blood flow, blood supply, oxygen, nutrients from going from point A to point B. Then what happens? The brain shrinks or it becomes, it atrophies. And when that happens, wherever the plaque started to accumulate is where the impairment is going to start from. So now sometimes, again, family members may be acting strange. Friends may be acting strange. They may be seeing things. They may be hearing voices. We have to be really proactive into getting them care, the care they need, the assessments they need. Okay, so first off, I talked about the Alzheimer's, and that's just extremely brief. We'll come back to it. There's a vascular cause of dementia, and this can be caused from multiple strokes. Now, when I say multiple strokes, I'm not only referring to the big strokes that a lot of people may know. Oh, this person had a stroke. They can't walk. They can't see. They can talk. Not just that. Yes, that can affect the brain and cause dementia. However, there are tiny, tiny blood vessels in the brain, and whenever there are conditions like high blood pressure, high cholesterol, high glucose levels, as in diabetes, smoking, sleep apnea, you know, heart conditions like atrial fibrillation, where the heart doesn't beat like it's supposed to do, it causes narrowing of these tiny, tiny blood vessels in the brain. And with time, it causes what we call small vessel disease. And it's a tiny blood vessels that narrow, but then it accumulates to each other and it forms these little like patches of itself. That also can continue to affect cognition if it is not treated in time. Okay, but these things are typically linked to risk factors. So that is why you cannot just and should not just accept the diagnosis of just dementia. What caused the dementia? Is it Alzheimer's? Is it vascular? Right? There's another type of dementia called Lewy body. And for that specific one, a different protein accumulates in the brain. Now, this protein is called alpha synuclein, right? It also forms these plaques. And for interesting reasons and complex reasons, for most people, they start to have these visual or auditory hallucinations. They're hearing things that are not there. They're seeing people or things that are not there. Their cognition can literally just fluctuate. It can change. They're really alert one time and then they're completely not there. They can be staring into space, you know. So, again, what is causing the dementia? Now, we talked about Alzheimer's, vascular, Lewy body. You also got to know there are reversible causes of dementia. Those are called pseudo dementia or reversible dementia. Certain things, um, anxiety, depression, let's see, those are the big ones. Metabolic conditions. So let's say thyroid issues, low thyroid, vitamin deficiencies, B12, B6, B9. Those are crucial to nerve health. And so those are the main workup that I do in the clinic when someone comes to see me with any concerns of cognition. We get blood work, we get imaging, and a lot goes into history. History plays a big role. So again, if you have any issues, if you're thinking about, you look at your life or you know somebody and you're like, something is just off, start somewhere, whether it be a primary care provider. They can check the labs, they can do like a very quick exam and just to check, to see if there's truly an impairment. If there's an impairment, is it something that can be reversed? Is it something that is, progressive? Is it a neurodegenerative disorder? And thank God we do have disease modifying agents now. Unfortunately, it is not necessarily cure the disease. However, it can slow it down and improve quality of life. All right. Now, you have to take care of yourselves. You do. You have a role. There are some genetic factors that you may not have anything to do. But when it comes to things that are modifiable, we talk about modifiable risk factors, you have to be on top of that. There are things you do not feel. If your blood pressure is high, you will not feel it. Unless in select patients, it gets so high that they get headaches. In that moment, how would you even know if that headache is from a blood pressure? You have to make sure that you are going for your regular um, physician visits, primary care visits. High cholesterol, elevated cholesterol, you got to take care of that. If you snore, you wake up tired, you wake up coughing or choking, you're starting to have, or you don't even have any of this, but then you're extremely lethargic, tired during the day, you have to at least start with your primary care. Ask about a sleep study. All these are reversible causes of dementia, okay? Or even mild cognitive impairment. Now, alcohol. Your alcohol intake, you have to be very careful. Again, I've seen patients in the clinic who I have diagnosed with alcohol induced dementia. They have exposed their bodies, their brain to excessive amount of alcohol over several years that it has caused irreversible damage to the brain and it caused dementia. So you see, there are so many causes of dementia. Don't accept the diagnosis of dementia. Ask further questions. What is causing it? The I don't know, several years, not a few, actually several years ago, if anybody had any dementia diagnosis, it was kind of automatically considered to be Alzheimer's. We didn't have a lot of testings. We didn't have biomarkers. Things have changed. Medicine is progressing. And so now we can actually decipher what type of dementia it is. Granted, towards the end, most of them, they all kind of tend to look the same, which can be quite sad because you think about what the brain can do, controlling our emotions, our decision making, our sensation, our movement, our breathing, the involuntary actions like even breathing, right? Our heart rate, all of that. You look at that, if there is impairment, if there's a disease that prevents this from working like it should, it can get to a point where people cannot even feed themselves, they can't even walk, they can't talk, They can barely form sentences, and that is like the last stage of dementia. It is unfortunately a very hard, terrible disease, not only on the patient, but on caregivers as well. So, now, I just mentioned a few causes of it. I hope to keep these videos as short and hopefully as simple as I can. And I'll stop here. And then if you have any specific questions, any specific topics you want me to address, then going forward, I will do that. Now, I will take a specific type of dementia on its own. We can talk about it. We can talk about possible treatments, but I have to give this disclosure. I am not your provider, so I cannot provide direct medical advice for you. If you have any questions, I can give you general answers, but you have to follow up with your own primary care provider or your own neurologist. I'm just here to provide general education for the public and for my viewers. So I hope that was useful. And I look forward to more interactions, and I look forward to hearing from you, feedbacks. If you have any questions, any suggestions, actually just drop it in the comment and like, comment, subscribe, click that notification button. That way, if I make another video, you can be aware of it, and then we can all learn about the brain together. All right. Stay blessed, beauties.